I'm writing my research paper on the controversial issue of whether a pregnant woman should be required to take a mandatory drug test. There are many that feel that it's a violation of the woman's civil rights, and others feel that the infant should have the right to be born addiction-free. Whenever a pregnant woman goes to the doctor during their prenatal care visits, they are tested for many STDs such as HIV, chlamydia, herpes, and gonorrhea. Why? Basically to protect the unborn child, give the mother treatment so that it's not passed on to the unborn child. An example of this would be if a woman tests positive for herpes and she is having an outbreak at the time of her delivery, she has to get a C-section rather than have a vaginal delivery so that the virus is not passed on to the baby. In the 80s and the 90s, crack cocaine was the drug of choice, and there were many babies that were addicted to the drug. However, now the burden of the addiction has become prescription painkillers such as Oxycontin and Vicodin. A lot of these drugs are prescribed for previous injuries, and the mother became addicted prior to becoming pregnant. And yet there are some that are illegal street drugs that these pregnant women become addicted to. Prescription painkillers are highly addictive, and it's very hard to give up once you have become addicted to them. And there's no one, especially a pregnant woman, should quit cold turkey. Once the mother starts withdrawal, so will her fetus, which could cause a spontaneous abortion. Pregnant mothers should enter a treatment program where they are given methadone or Subutex, which will lessen the withdrawal symptoms. Infants born to mothers who have had treatment in a treatment center have less severe withdrawals. Once the infants show signs of withdrawals, they are given a diagnosis of neonatal abstinence syndrome, or NAS, and there's a scoring system that is set up according to their symptoms. If the infant gets 3 scores greater than 9, then they are put on morphine or methadone. And the scoring consists of several things, and these are like fever, sweating, sneezing, yawning. They have a high-pitched cry. They scratch their face. They have skin breakdown because they have loose stools. They don't know how to stop eating, so they'll eat until they vomit. We have to actually stop these infants from eating. They are startled easily and have tremors, and they can't sleep for more than 30 to 40 minutes at a time when a newborn should sleep 3 to 4 hours undisturbed. They just can't do this. Many feel that mothers will not seek the prenatal care if they know they will be drug tested, but if they have the opportunity for treatment rather than punishment, they might seek the help. We must remember that these babies are going to go home with mothers who are addicted to drugs. If she doesn't seek the treatment before this, it is unlikely she will ever get help. Then the baby will grow up in an environment where drug addiction is common, and that cycle will likely continue.